This is my SATs, 95%, and my heart rate, 93 to 95%. Hey YouTube, this is Catching Up with Crystal. Can you keep up with me? Because you never know where I'm going to be today. I'm home. I had to shut the clinic down because I'm not feeling well. I just wanted to pop in and make this video. I'm so disappointed in healthcare in America. My provider or my doctors are in Philadelphia, so it's a different state than I live in. And so I have not been feeling well for the last 3 days, 4 days. My symptoms are as follows. And you tell me what you think should be done. I'm going to post this and I'm going to post it in some medical and nursing groups. And you tell me if I should be upset. Now, I went to an urgent care because I just did not want to drive to my doctor's office. I have a history of sarcoidosis, which, if you know what that is, you know that it affects your lungs. And I do have some lung issues, but my pulmonary doctor always says I'm the best doctor, a best patient she has. My SATs run normal. My normal saturation is 97 to 100%, and 100 is perfect. Last 3 days, it started with a sore throat. And then I started to get body aches. I got body aches. I have developed sweats, chills, and yeah, I'm sorry. Lost my sense of taste. My nose was completely stopped up. And then it was running after I took some Sudafed. I was treating with over-the-counter stuff. I've been coughing up thick yellow green secretions. Other symptoms are fatigue, and I cough up. I have a productive cough. I'm coughing up chunky yellow. I'll insert a picture. Chunky yellow to green secretions. I do have a history of pneumonia. I had pneumonia in 2022. I've had COVID in 2022 twice. And so I guess basically those are my symptoms. Changes in my my hoarse voice. I was having some pressure in my ears and my nose, which is normal. Ear, nose, and throat are connected. So I go to the urgent care and I get this physician assistant, and I'm a nurse practitioner. And this is the shirt that I wear when I go over there this morning. And so she seems to be struggling even logging onto the computer. And she, I give her my history to the medical assistant. And then, I guess the medical assistant didn't give her the whole history because she just said, oh, you're here with chest pain. Now, it hurts when I cough. But the medical assistant said I had chest pain and a cough. So chest pain is, if you tell me you got chest pain, I'm thinking cardiac first. But anyway, I'm not going to drag this video out. I'm just going to stick to the facts. So anyway, this is the shirt I'm wearing. And so she's struggling with the computer, and I'm saying she can't log out, the medical assistant, and she can't log in. I said, well, hit the secure button, and that'll log out the MA, and then you can log in. And she was like, because I can't see, what's going on with you. and I could see it outside the room. I said, well, did you log out outside the room? Log off there, maybe log in. She was like, oh, do you work in healthcare? You seem to know a lot about healthcare. I said, I know a lot about EMRs. And I said, yeah, I do work in healthcare. I'm a nurse practitioner. So she is able to make it through the getting into the computer. I tell her what my symptoms are, including that I have a moist cough. It's painful. I'm producing mucus, green. I have a history of sarcoid. I've had pneumonia in the past. And she doesn't do a COVID test. She doesn't do an influenza test. She listens to my lungs and she says my lungs are clear. I'm going to insert some pictures. That video of my SATs, your oxygen, for those who are not medical, your oxygen level should be, a normal one is greater than 95% to 100, whatever your baseline is. Like I said, mine normally runs 97 to 100. My heart rate was running between 112 and 115. I'm coughing. I coughed in front of her. You can hear the loose, moist cough. I'm short of breath, and this woman says that my lungs are clear. That's possible, but I said they might be clear, but they got to be decreased because I cannot take a full breath. When she asked me to take deep breaths, it caused bronchospasms, and I was coughing. And she could hear the moist, wet cough, and I was swallowing back what I was bringing up. So I said, well, can I have an x-ray? Because I do have a history of sarcoid, and I also have a history of pneumonia. So she orders that. But again, no COVID test, no COVID, no flu. She doesn't even palpate my lymph nodes to see if they're enlarged. She listens to my lungs, listens to my heart, looked in my ears, and then said that I should just take over-the-counter cough syrup, which I've been doing. But I told her I'm getting progressively worse, and these vital signs are not my baseline. So she said, well, let me go back. She said, well, I can't tell you if you got pneumonia or not because there's nobody here to read the x-ray. So we'll let you know if you have pneumonia. Okay. So then she says, if you don't feel better in 7 days, come back. I was like, lady, it's been 3 days and I'm telling you my symptoms are getting worse. And I have a history of sarcoidosis. I'm short of breath. My SATs are 93%. My heart rate is 115. My blood pressure is elevated. I'm short of breath. Something is going on. And you saying come back in 7 days? She said, well, what would you do? Oh, no, she said, what do you want me to do? I said, if somebody like me came in with my history and what I've told you, I would at least give me a bronchodilator so I could breathe. Can I get an inhaler? So she says, you want an inhaler? I was like, can I get an inhaler so I could breathe? And then I said, and an antibiotic. She was like, well, I could write a script for an antibiotic. Guess what she writes the script for? Doxycycline. That is not the first line. Doxycycline. I mean, I'm going to have some good skin. My skin is already good. I don't have no acne. I don't have any wounds. Doxy's good for wound care. I'm not allergic to penicillin. So can you tell me why her first choice was doxycycline of all things to prescribe for me? And that's after me pulling teeth with her. I don't know if she was a brand new PA. I don't know if she got intimidated because she sure wasn't going to do anything and didn't do anything until I told her to send over a script that this is what I would do if somebody like me showed up in my clinic. You could look at me and see that I'm sick, I'm pale, my vital signs did not lie. I didn't catch what my temperature was. I asked her what my temp was. She didn't know. She was like, oh, you don't have a fever. But she didn't give me a number. But I took pictures of the other numbers. So I said, well, when will your notes be done so that I could send them to my provider in case they want to see something or do something? She was like 72 hours. This chick, healthcare is going down the tubes. I'm obviously sick. I got a pre-existing lung condition. What would you do? That hurt. All right, stay tuned. I'm going to insert the documentation.